What would life be without ethics? Probably pretty chaotic. Kind of like the movie The Purge, which freaks me out a little bit. But now think about what therapy would be like without ethics. Hi, I'm Kim Long, and I'm a psychologist with Dochas Psychological Services in Spruce Grove, Alberta. So when you think about ethics, ethics are really about rules of conduct, but it's also about morality. So it kind of guides us for what is right or wrong morally. Point of view is also really important. So for example, do you save one person from the train tracks, or do you save as many as possible, like a group of 7 from the train tracks? But now consider that that one person might be your grandmother, or maybe a young child. Maybe your decision would change depending on other aspects of the context, right? So ethics aren't super clear cut. And what the governing bodies for psychology had to do is they had to come up with this kind of code of conduct, or our ethics code, that considered context but still told the rest of us kind of these are the clear parameters around what's right or wrong for our profession. And I mean, before we go much further, we should maybe talk about why that's important to you. And the reason why it's important to you is because it's the college's job to protect you. It's not about protecting us as psychologists. It's about making sure that we are doing no harm to you, our clients. And also, please note that the ethics code that I'm going to be talking about today is our Canadian Code of Ethics for Psychologists, which is based on the American Code. But if you're watching this anywhere else, which, hello, if you are, this is about the Canadian Code, so there may be some differences. Okay. In our Canadian Ethics Code, we are guided by 4 key principles, and these principles are meant to guide all of our decisions. So the first one is respect for dignity of persons. And what that basically means is that we need to make sure that our decisions are fair, non-discriminatory, that there's informed consent, that these decisions protect vulnerable persons and also protect privacy. So the next one is responsible caring. And this basically means that we ensure that there is no harm, or as little harm as possible, that we look at risks and benefits in our decision making, and that we fix problems once we know that they've occurred. It also is about practicing within our scope of practice. So what that means is that I am mainly a counseling psychologist, which means I provide talk therapy. I'm not going to go out without training and start doing assessments like those 4-hour assessments that could happen, because that could cause harm. So that's what responsible caring is about. The third one is integrity in relationships. And what that means is that, well, it's kind of how it sounds, but it's about being open and honest and unbiased and avoiding conflicts of interest. And what that means is this is where you make sure that you aren't having a relationship with your clients, or where if one of your clients has some really great business contacts, you aren't using your client in order to get those business contacts. You are maintaining that therapeutic relationship. And then the last one is responsibility to society, which basically means that we are using psychological knowledge for good and not evil. And that if we find out that psychological knowledge is being used in a way that is not what our profession is about, or is harmful to society, then we need to take steps to stop that. Okay, so now the difficult part becomes if these principles are ever in conflict, which is what usually happens. We are actually supposed to take them in that order. So respect for dignity of persons, responsible caring, integrity in relationships, and responsibility to society. We're supposed to take it in that order and weigh them accordingly. And the reason why is because our code believes that the dignity and well-being of a single person should never be sacrificed for society. So again, all of this is about protecting you. So imagine if we weren't being ethical. Well, the question becomes, what do you do then? So you have a couple of options. The first is always the option of talking to your therapist. If they're doing something that you're really uncomfortable with, you need to let them know. However, I understand that there are times when you don't feel like that's possible. So remember that that's what our college is for. So in Alberta, you would contact the College of Alberta Psychologists, and they have a whole division that is devoted to this. And so you would just give them a call and let them know what's going on, and then they investigate. So you do have ways to go about protecting yourself. Okay. So with that, that's enough about our ethical spiel for today. I invite you guys to actually try making some ethical decisions. There was this guy in the past, Kohlberg, and he came up with a whole bunch of scenarios, and it was to assess what level of ethical awareness, of ethical development we were all at. And so he actually, well, not he, but somebody compiled some of these ethical scenarios and put them on the web. So I am going to put a link down in the descriptor underneath the video. Feel free to click on that link and it'll take you to some of those ethical scenarios. And I invite you to try figuring out, what would you do? Maybe even use our 4 principles and see what you come up with. Yeah, that's about it. So anyway, as always, thank you for watching, and until next time, please take care of yourself. Bye.